Unit 5 Food and Health. Food should contain all the minerals needed by our body called nutrients, proteins, carbohydrates, fats, vitamins and minerals are the nutrients. The different food items may be rich in one or the other kind of nutrients. Nutrients along with water and roughages form the balanced diet. Balanced diet is necessary to remain healthy and strong. Functions of nutrients. Nutrients found in different food items have different functions. 1. Carbohydrates and fats. Carbohydrates and fats present in the food items give us energy. They are major source of energy. They provide energy to the body to do work and play. Food items such as rice, chapati, bread, corn, potatoes and sugar contain carbohydrates. Food items containing carbohydrates. Food items such as butter, ghee, cheese, yolk, milk, egg, meat, nuts and oil contain fats. Food items containing fats. Two. Proteins. Proteins help in bodybuilding and growth. They repair the worn out tissues. Food items such as pulses, milk, cheese, eggs, fish, meat, soya beans, etc. are rich in proteins. Food items containing proteins. 3. Vitamins and minerals. They protect us from diseases and keep us healthy. Fresh fruits, vegetables and green leafy vegetables are good sources of minerals and vitamins. Food items containing vitamins and minerals. Our body needs not only the balanced diet but regular exercise and enough rest also. Exercise. Regular exercise helps in developing and toning of muscles. Muscles may become weak and flaggy if they are not used for a long time. Exercise increases the flow of blood to the muscles. Rate of heartbeat and circulation of blood become fast by exercising. Thus, more O2 is taken in and more carbon dioxide and water vapor are given out. Sweat glands in skin become more active. Exercise also helps the nervous system by supplying extra blood to the brain. A good posture gives a graceful appearance to our body. Different types of exercise. Enough rest. Proper rest and regular hours of sleep increase our efficiency and strength to work. A good sleep gives our body rest and we feel fresh and ready to work again. Sleep also gives time to the body for growth and repair of body cells. Diseases. Any change in the normal form or function of our body is called disease. When we are sick, neither our body nor our mind is at ease. There are different kinds of diseases. Deficiency diseases and communicable diseases are some types of diseases. A. Deficiency diseases. Diseases that are caused by lack of nutrients in our body are called deficiency diseases. They cannot spread from person to person. Some of the deficiency diseases are: 1. Protein carbohydrate deficiency disease. It is usually found in little children between the age of 6 months and 3 years. It occurs because of deficiency of proteins and carbohydrates in the diet. Symptoms: 1. The child does not grow and is thinner than other healthy children of the same age. 2. The child gets tired and dull very soon. 3. The child does not show any interest in playing. 4. The child has very thin and light hair. 5. The child's skin becomes loose and scaly and has sunken eyes. Cure: a variety of soft boiled food items such as dalia, mashed vegetables, fruits should be given besides mother's milk from the age of 4 months. These food items are rich in proteins and carbohydrates. Deficiency diseases are also caused by lack of vitamins and minerals in the diet. Some of these diseases are: 2. Vitamin deficiency diseases. Vitamin A deficiency. Lack of vitamin A in our food causes night blindness. This disease is not total blindness. The child with this disease cannot see the objects clearly in dim light or in the dark. If this disease is not treated in time, the child may become completely blind. Eyes become dry and dull. White triangular patches can be seen on the white portion of the eyes and has dry and scaly skin. Green leafy vegetables, papaya, carrot, yellow pumpkin, milk, and milk products contain vitamin A. Food items containing vitamin A. Vitamin B deficiency. The deficiency of vitamin B causes a disease called beriberi. The symptoms of this disease are loss of weight and appetite, retarded growth and weakness. This deficiency is cured by taking food items like green leafy vegetables, whole grains, sprouted pulses, groundnuts, brown bread, etc. Food items containing vitamin B. Vitamin C deficiency. The deficiency of vitamin C causes scurvy. The symptoms of this disease are bleeding of the gums and swelling of joints. It is rich in citrus fruits, amla, grapes, tomato, guava, lemon, green leafy vegetables, etc. Food items containing vitamin C. Vitamin D deficiency. The deficiency of vitamin D causes rickets, which makes the bones soft. Bowed legs, bending of ribs, and bulging of backbone are caused by the softness of the bones. We should eat food rich in vitamin D, such as milk, eggs, cheese, butter, and fish. Expose naked body to sunlight, which is a natural source of this vitamin. Food items containing vitamin D. Three, mineral deficiency diseases. Iron. Lack of iron in our body causes anemia. The child suffering from anemia has pale and tired look, has colorless lips and flat nails. Iron is present in apple, banana, spinach, brinjal, pulses, meat, and liver. Calcium. Calcium deficiency causes weak bones. Milk and milk products are rich in calcium. Calcium makes our bones and teeth hard and strong. Iodine. Lack of iodine causes goiter, swelling of a gland in neck region. It can be prevented by using iodized salt. Seafood is also rich in iodine. The deficiency diseases are caused not only due to lack of proper food intake, but also be caused by repeated infection, worms in intestine, diarrhea, etc. So we must wash our hands before using any food item and drinking water. We should avoid overcooking, throwing away the water in which rice was cooked, etc. B. Communicable diseases. Diseases that spread from one person to another are called communicable diseases or infectious diseases. Cholera, typhoid, measles, chickenpox, jaundice, malaria, plague, etc. are communicable diseases. These diseases are caused by tiny living things called germs. These germs cannot be seen with naked eyes and can be seen only under microscope. They are harmful as they cause various diseases. The common germs are bacteria, viruses, protozoans, and fungi. Bacteria. Bacteria cause diseases like typhoid, cholera, tuberculosis, plague, etc. These bacteria are single-celled plants and are round, rod-like or spiral in shape. Viruses. Viruses cause diseases like common cold, flu, rabies, measles, polio, smallpox, etc. Viruses are much smaller than bacteria. They can be seen only with electronic microscope. Protozoans. These cause diseases like malaria, amoebic dysentery, etc. Protozoans are single-celled and much bigger than bacteria. Fungi cause ringworm. They are larger than bacteria. They are small, non-green plants. Bacteria, viruses, fungi, mold, amoeba. Spreading of communicable diseases. Communicable diseases can spread in many ways. Some common ways by which these diseases spread are: 1. By air. When a sick person coughs or sneezes, the germs release from his body and enter into the air. These germs spread in the air. They enter a healthy person when he breathes in. Chickenpox, whooping cough, diphtheria, influenza, etc. spread by air. 2. By direct contact. Germs of diseases like chickenpox, measles, common cold, and cough are easily passed on through direct contact, that is, through clothing or articles used by the sick person. 3. By food and water. Diseases like typhoid, cholera, jaundice, diarrhea, dysentery are caused by taking infected food or contaminated water. Handling food and water with unclean hands and lack of sanitary conditions pollute food and water. 4. Through cuts. Many germs enter the body through cuts or injuries in the skin. Tetanus spreads in this way. 5. By insect bites. Blood-sucking insects like mosquitoes, fleas, bugs, etc. cause diseases like malaria, plague, yellow fever, dengue fever, etc. Malaria spreads through only a certain type of mosquitoes. Female Anopheles mosquitoes. When the mosquito bites a sick person, the protozoans are sucked up with blood. When the same mosquito bites a healthy person, the protozoans are passed into his blood and cause malaria. Bedbug mosquitoes. 6. Through carriers. Sometimes diseases are caused by healthy persons carrying germs of some diseases like typhoid, cholera, dysentery, and smallpox. The healthy persons may be carrying the germs of the diseases, but they do not suffer from these diseases. They are called carriers. 7. Through polluted soil. The eggs and larvae of hookworm are found in soil. When a person walks barefoot on such soil, these larvae enter the body through the skin between the toes. Prevention of communicable diseases. The spreading of communicable diseases can be checked in the following ways. 1. By preventing the breeding of germs and insects. Houses should be airy and open to sunlight. Most of the germs die when exposed to air and sunlight. Windows should have wire netted to prevent the entry of flies mosquitoes, etc. Use covered dustbins to prevent the breeding of flies. Clothes and bedding should be placed in sunlight from time to time. Never dump garbage near your house. Keep the surroundings clean. Never allow water to stagnate near the house. Toilets and bathrooms should be cleaned with disinfectants at regular intervals. Drink clean and safe water. Always keep water and food well covered. Boil milk to kill the germs present in it. Milk should be heated at high temperature and then cooled. This heating and cooling kill harmful germs. This process is called pasteurization. Louis Pasteur developed this process. All cases of infectious diseases should be informed to the health officers so that they may take the necessary precautions to check the spread of these diseases. 2. By preventing the spread of germs from the sick. The patient should be kept in a separate room. His clothes and utensils should be kept separate. These should be disinfected by boiling in water. Children suffering from diseases should be not allowed to go to school unless they are fully recovered. The patient should be made to spit or vomit in a separate bowl or in a toilet. Mosquito repellents should be used to keep away the mosquitoes. 3. By increasing resistance against germs. Resistance to disease germs is called immunity. It can be developed by taking vaccination. It protects us by acquiring immunity against certain diseases. Children are vaccinated as a protection against diseases like cholera, diphtheria, typhoid, tetanus, measles, mumps, meningitis, etc. This is done by health centers. The following table shows the age at which the vaccination is done for different diseases. Age, name of the vaccination, diseases against which the vaccination is given. At birth, BCG, tuberculosis, between 6 weeks to 9 months, triple antigen, DPT, 3 doses at the interval of 4 to 6 weeks, polio, 3 doses at the interval of 4 to 6 weeks, diphtheria, whooping cough, tetanus, between 9 months to 1 year, measles, 16 months to 2 years, DPT and polio booster dose, polio, 5 to 6 years, typhoid, 2 doses, typhoid, 10 years, tetanus toxoid, tetanus. Communicable diseases have been controlled to a very great extent with the help of the above measures. And also, if we cooperate with the authorities to keep the surroundings clean, we can be away from these diseases. Let's revise the important points. 1. Our body needs balanced diet, regular exercise, and enough rest to remain healthy and strong. 2. Deficiency diseases are caused by lack of nutrients. They can be cured by proper intake of balanced diet. 3. Different nutrients serve different functions. 4. Deficiency of vitamins and minerals also causes various diseases. 5. Diseases which spread from one person to another are called communicable diseases. 6. Communicable diseases are caused by bacteria, viruses, protozoans, etc. They spread through air, water, injuries, cuts, etc. 7. Communicable diseases can be prevented by preventing the breeding of germs, by vaccination, and by keeping the surroundings clean. Do